I've always felt like my mind was on overdrive. I would forget simple tasks and struggle to focus, even on things I loved.
School was a challenge. I felt restless and lost among my peers who seemed to have it all together.
It's not that I didn't care or that I was lazy. My brain just operated differently.
ADHD in adults. Unraveling the myths and misconceptions. Attention Deficit Hyperactivity Disorder, or ADHD, isn't just a childhood condition. It's a lifelong journey that affects countless adults worldwide. ADHD in adults is an underdiscussed and often misunderstood topic. Understanding the reality of ADHD can help in untangling the web of myths that surround it. According to a study published in JAMA Psychiatry in 2017, an estimated 4.4% of adults in the US experience some form of ADHD. Yet this figure might only be the tip of the iceberg. Many adults go undiagnosed and untreated, attributing their struggles to personal flaws or the stresses of adult life, rather than a neurodevelopmental disorder. For the unacquainted, ADHD symptoms might look like everyday forgetfulness or occasional daydreaming. In reality, these seemingly minor lapses can have profound implications for the affected individual. Routine tasks can turn into daunting challenges, and maintaining relationships or holding down a job can sometimes feel like an uphill battle. The stories and struggles of adults with ADHD often remain untold, overshadowed by the pervasive narrative of ADHD as primarily a child's concern. There's Emma, a brilliant lawyer, who despite her remarkable courtroom skills, often misplaces her files. Or David, an innovative artist, whose ideas overflow, but who finds it nearly impossible to focus on one project at a time. As profoundly as Michael Phelps, the most decorated Olympian of all time, with a staggering 23 gold medals, was diagnosed with ADHD at the age of 9. Many, like Phelps in his early years, grapple with feelings of frustration and inadequacy, especially in structured educational settings. He recalls being constantly fidgety in class, often daydreaming and having difficulty focusing on his lessons. His teachers noticed his restlessness and, coupled with his energy in extracurricular activities, suggested he see a specialist. His parents and coaches played a crucial role in guiding him, channeling his energy into swimming, a sport where he'd find solace, discipline, and unparalleled success. Phelps' story stands as a testament to the boundless potential within each individual. ADHD in adults becomes clear that this is not a simple tale of distraction or laziness. It's about real people facing real challenges, and more often than not, displaying resilience in the face of adversity.
Disclaimer. This video is intended for educational purposes only, and is not a substitute for professional medical advice, diagnosis, or treatment. Let's now continue our journey to better understand mental health.
Historically, most ADHD research was pediatric-focused. While it offered invaluable insights into the pediatric dimensions of ADHD, it left a noticeable void regarding ADHD in adults. Recent studies have begun to bridge this gap. More resources are being allocated, and newer studies are being commissioned, ensuring that every facet of adult ADHD, from diagnosis to treatment, is explored with the depth and nuance it deserves. The Lancet Psychiatry published research in 2017 underscored that ADHD in adults often presents differently than in children. The hyperactivity witnessed in children may evolve into feelings of restlessness in adults, and inattentiveness might manifest as organizational challenges. This evolution in symptoms can lead to misdiagnoses. For example, an adult struggling with concentration might be incorrectly diagnosed with an anxiety disorder or depression, rather than ADHD. According to a survey by the National Comorbidity Survey Replication, of the 4.4% of adults ages 18 to 44 in the US diagnosed with ADHD, nearly 41.3% exhibited a severe form of the disorder. What's more telling is that this isn't just a transient phase. The World Health Organization's World Mental Health Survey Initiative noted that a median of 57% of children with ADHD transition into adulthood with the condition. This statistic becomes all the more poignant when considering that many might have been undiagnosed during their childhood, only realizing and addressing their ADHD when it manifests in more complex adult responsibilities. The American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, 5th edition or DSM-5, classifies ADHD into 3 primary subtypes. 1. ADHD predominantly inattentive presentation or inattentive type. Our individuals diagnosed with this subtype often find it challenging to organize or finish a task, pay attention to details, or follow instructions and conversations. They're easily distracted, forgetful, struggle to maintain focus, and aren't hyperactive. This subtype was previously termed simply as Attention Deficit Disorder or ADD. 2. ADHD predominantly hyperactive impulsive presentation or hyperactive impulsive type. Exhibit behaviors like restlessness, impatience, difficulty sitting still, and impulsivity. They may rush through tasks or blurt out answers, even before a question is completed. While they may focus on a task, they do so intensely, often forgetting the world around them. And 3. ADHD combined presentation. This is when both inattentive and hyperactive impulsive symptoms are present, and is the most common presentation among those diagnosed with ADHD. Note that these symptoms aren't indicative of carelessness or lack of respect. They are directly related to how the individual's brain manages attention. Now, what are the treatment options? 1. Behavior therapy. Often recommended as the first line of treatment, especially for younger children with ADHD. Behavior therapy helps individuals develop skills to cope with and change their behavior. For adults, cognitive behavioral therapy or CBT can be instrumental in reshaping negative thought patterns and introducing coping mechanisms. 2. Medications. The National Institute of Mental Health or NIM underscores 2 primary types of FDA-approved medications for ADHD: stimulants and non-stimulants. 3. Professional advice. Dr. Leonard Adler, a leading ADHD specialist and the director of the Adult ADHD program at NYU Langone, emphasizes the need for a multimodal approach. This means combining behavioral therapies, medications, and lifestyle modifications for a holistic treatment strategy. Furthermore, psychoeducation, where patients and their families are educated about ADHD and its impacts, can be instrumental. Knowing more about the condition can reduce potential stigma and help individuals and families advocate for their needs more effectively. It's vital to note that medication should be considered in conjunction with a healthcare professional's advice. The beacon of hope in ADHD treatment is its adaptability. Each person's experience with ADHD is unique, and as the therapeutic approach can be tailored to individual needs and circumstances. So it is best to educate. Knowledge remains one of the most potent tools. Through understanding, we dispel myths, creating a society more accommodating and supportive of ADHD's unique challenges. Embrace multimodal treatments. Remember that there's no one-size-fits-all treatment for ADHD. Harness strengths. As ADHD, while a challenge, also brings a suite of strengths, including creativity, enthusiasm, and a unique perspective on problem solving, that can lead to remarkable achievements. Establish routines. Consistency can be an ally. Establishing and maintaining a daily routine, with set times for sleeping, eating, working, and relaxation, can bring predictability and order, making daily tasks less overwhelming. Lastly, professional help. Don't hesitate to seek out therapists, counselors, and medical professionals who specialize in ADHD. Their expertise can pave the way for better coping mechanisms and more informed decisions. Therefore, ADHD, despite its challenges, is not a determinant of one's potential or worth. From Michael Phelps' Olympic feats to successful entrepreneurs, artists, and thinkers, ADHD's story is far from being solely about struggle. It's also about triumph, adaptability, and the celebration of neurodiversity. Our society stands on the cusp of a paradigm shift, one where ADHD is recognized, understood, and accommodated. By remaining informed and compassionate, we inch closer to a world where every individual, ADHD or not, is equipped with the resources and understanding they need to thrive. So seek assistance, stay informed, and never lose hope.